All right, good morning, everyone, and thanks for joining. We have gotten a lot better at Zoom over the last couple of weeks, but this is the first time we've tried a town hall with this many people, so I appreciate in advance your patience. For those of you who don't know, I'm Jim Ryan, the president of UVA, and I'm joined by our Provost, Liz Magill, our COO, JJ Davis, and our EVP for Health Affairs, Craig Kent. Our goal is to share with you the latest updates on our response to the pandemic. We'll start by going around and sharing the latest on what's happening in each of our respective areas, and then take questions. If you have questions, you can please type them into the Q&A box, and we will answer as many as we can. You can also find answers to frequently asked questions at our website, virginia.edu/coronavirus. So I believe we have students, faculty, staff, and members of the community on this call. So the first thing I want to do is to thank all of you for everything that you're doing and for the sacrifices you're making in order to keep people safe. I hope you and your families are well and healthy. And if any of you or anyone you know has the virus, that you or your loved ones recover fully and quickly. As you know, we are facing an unprecedented public health crisis that is quickly moving and evolving. To give some perspective, the first case of COVID-19 in Virginia was confirmed just a little more than 3 weeks ago on March 7th. As of today, there are roughly 1,500 cases, which include members of our community. This unfolding crisis has required us to make a lot of difficult decisions quickly and often with imperfect information. Our main goal has been to keep our university operating so we can carry out our core missions of teaching, research where possible, and medical care, all while doing our best to keep our community healthy, safe, and connected. Toward that end, it's more important than ever that we support each other as we are truly in this together. I understand that some Asian and Asian American students and faculty have been on the receiving end of xenophobic threats and abuse here in Charlottesville and on grounds. This is both intolerable and reprehensible, and for those who have been a target of this abuse, I ask that you let us know so we can do our best to stop it. So I thought what I would do in my brief remarks is give you an overview of where we've been, where we are, and where we're headed. So I think of this as unfolding in several phases. In phase one, our main focus was on getting students off grounds and back to their homes and getting our courses online. Both were huge lifts, and I'm happy to say both have been quite successful. There are only roughly 300 students still living on grounds, and we now have over 4,200 classes online. And this required the work of a great deal of people, including faculty and staff, and I'm enormously grateful. And I know Liz will talk a little bit more about the online classes. Phase two was really about transitioning to working remotely and enabling employees who could work from home to work from home. And it was also about ramping down our research while preserving the advances that we've made. Phase three, which is the phase we're in now, is really about focusing on the health system, which Dr. Kent will talk more about, and making sure that we're prepared for what we know is coming, which are more patients with COVID-19, and preparing generally for what that will mean for the health system and beyond. We're also planning for the future, which includes mitigation planning for the financial impact that this crisis has caused. There's little doubt that we are going to be facing some critical financial decisions in the weeks and months to come, given both the impact this crisis has had and the discouraging economic forecasts we're facing. Phase four is really about the longer term, and a question I know on a lot of people's minds and ours is what's going to happen in the fall. Our sincere hope is that we will be able to be up and running and back to normal by the fall semester, but it's honestly too early to tell, and it's going to depend on the progression of the virus. We're now working to identify the date by which we need to make a decision by the fall. We'd like to push that date back as far as possible so we have as much information as we can to make the decision, but we also recognize that we need to make it far enough in advance so that people can plan. So we will be back in touch on that in particular. Let me give just a few more updates before I turn it over to Liz. In the category of emergency preparedness, we're making plans for additional housing needs should they arise. We have plans in place for housing first responders and health system workers, as well as members of our community who may need to self-isolate or quarantine and can't do so at home. We are also working on final exercises. We've assembled a working group of students and staff to develop ideas, and they'll be reaching out to graduating students soon to get their input. We began issuing credits and refunds for dining and housing costs this week, and my great thanks to the finance team and the team from Student Financial Services for getting this in place. It was not an easy task. We started Arts on the Hill last week, Arts on the Hill, the digital edition, which features musical performances and poetry and stories from members of our community. It broadcasts every Sunday night at 8 p.m. We've done this as a way to help our community stay connected and connected to grounds. We are coordinating with the City of Charlottesville and Albemarle County on ways that the university can help members of the broader community during the pandemic and afterwards as things get back to normal. And we'll have more to share about that in the next week. Finally, you may have heard that a group of researchers and lab professionals developed a test for COVID-19 on grounds. This was the first local test developed in Virginia, and it reduced the wait time from days to hours. We are now offering the test to hospitals across Virginia. And Craig can talk a little bit more about that, but it is a bright spot in all of this, and great credit to those who worked on this and those who contributed to the work. I've said before that this is going to get worse before it gets better. We haven't yet hit the peak here in Virginia or in Charlottesville, and models now suggest that peak will occur somewhere between late April and late May. So we are going to be dealing with this for some time, which will make it harder and harder. And we're going to see more patients in the health system with COVID-19. I recognize that there is still a great deal of uncertainty, which we can't eliminate because we can't yet predict with precision how this virus will progress. But we can continue to do as our best to make the best decisions we can in as timely a way as we can and to communicate them to all of you as plainly as possible. So thanks to all the members of our community for your support, your creativity, your dedication, and your resilience. And a special thanks to the doctors, nurses, and team members at the medical center who are doing heroic work and still face a long road ahead. They deserve our deepest gratitude and support. With that, I will turn it over to Liz. Thank you.
Thank you, Jim, and thanks everyone for calling in. I'm going to share a couple of updates from the academic division, the schools and units that are outside of the medical center is another way of putting it. First, a little bit of an update on the virtual instruction. As I know all of you know, and the president mentioned, we've moved classes online for the remainder of the semester. Archie Holmes in the Provost office and Virginia Evans, our Chief Information Officer, led a team from all the 12 schools working on this. It was a major lift, and I'll give you a couple of by the numbers facts that might be of interest. So if you want to be precise about it, we have 4,273 classes being offered this semester. They have all transitioned from in-person to virtual for this semester. This includes, of course, large lecture classes, but labs, discussion sections, photography classes, studio art, etc. 20,000 is the number of page views our teaching resource website had during the week of March 11th, which was all in preparation for the move to virtual instruction. 61,859 is the number of Zoom participants we had during our first day of online instruction, Thursday, March 19th, and 123 students have received support in the form of a computer or internet access, thanks to the work of our student financial services and student affairs folks who've provided that financial assistance for those who need it. We're committed, of course, to continuing to provide this support throughout the semester and have been thinking about the possible risks that we might be facing and mitigating those risks. The first is that we have heavy reliance on Zoom technology, as we're using right now. And as part of the risk management strategy, their schools are identifying courses that could move to asynchronous delivery from synchronous, that is a lecture that a student could watch at any time. The second risk really involves continuing to support students and faculty during this time. I'll talk more in a moment about the decision to move to a default credit, no credit grading option. The reality is that doing this in a sustained way past these first weeks is just challenging. And we're thinking about lots of different ways of continuing to provide support. The last update on the going virtual effort I'd like to identify is that we have at least 2 eyewitnesses to the online virtual experience. Last Friday, President Ryan and I joined Professor Sarah Kusenis's developmental biology lecture. It had 95 undergraduates in it. It was an incredibly inspiring experience. We appreciate the opportunity to be in that class, and it was quite remarkable. We talk a little bit about students and faculty, then a little bit about research, and then looking ahead, and I'll keep it short because I know there are lots of questions and others to speak. We adopted several interim academic measures this semester in light of the move to online teaching. We announced earlier this week that in-person summer programs through June 30th would be virtual. That includes academic delivery of courses in summer session 1 and 2 that are going virtual. For our undergraduate classes, we announced a default option of credit, no credit as a grading system for all classes. Students have the option of choosing on the last day of lectures, last day of classes, whether they want to receive a grade in the class rather than the credit, no credit option. Happy to explain the reasoning there. It's in light of the massive disruption that students faced in the course of this semester. This week, we're actually taking on several additional academic issues, the promotion and tenure clock for our tenure track faculty, how we're handling course evaluations. Maite Brand-Pierce, Archie Holmes, and Webb in the Provost office have been working on these issues, and we've of course been working very closely with the schools and the deans on these questions of academic policy. A final note on students and our academic program: Steve Mull in the Provost office, who's our Vice Provost of Global Affairs, and Dudley Doan, who runs the International Studies office, and their teams have been working day and night managing our global programs with one-on-one contact with the students who are on overseas programs and bringing them back or suspending those programs. You've probably read that we canceled our 40 UVA-led student summer abroad programs, including global internships. So there's been a lot of work on the international efforts with our students far-flung. A very quick update on research. I've worked closely with Vice President of Research Ram Rabasubramanian and Dr. Craig Kent, focusing on how we move our research mission, particularly our lab-based research mission. That is the kind of research that happens generally in person in a lab. We do have all sorts of research at UVA, much of which can be conducted remotely, but we've moved the lab-based research to key activities and have worked to make sure that graduate students are working in that lab-based research in a limited capacity. So that's been a big effort. Last, just looking ahead, we're focused on, of course, undergraduate and graduate admissions. On March 18th, we released the decisions for students who applied to the undergraduate program for the regular decision cycle. Our admissions office is working very hard to think about getting those admitted students the information and experience that they need to figure out where they want to matriculate. We have live streaming events with faculty, with current student panels, and a video message from Coach Tony Bennett. We're working with high schools and community colleges to address emerging challenges like receiving transcripts. It's too early to tell what coronavirus will do to our numbers, but we're watching that very closely. 21% of our incoming student population is typically international. That's dominated by international students in our professional and master's and PhD programs. We're thinking very hard about what to do about those students. I feel lucky to be part of this group of leaders in this university, and all of you who've joined in working so hard to confront the significant challenges we face. And I just appreciate the time to give you an update. And I'm going to turn it over to Dr. Craig Kent now.
Thanks, Liz. So I'm Craig Kent. I probably haven't had the chance to meet most of you because I've now been with University of Virginia as of yesterday, 2 months. I think President Ryan timed my entree, so he would test my ability to tackle challenges. But I can tell you something, still maybe being a bit of an outsider, that you have one of the best academic medical centers in the country. I've gotten to know well the leadership team at UVA over the last couple of months. We've spent an intense number of hours together. They're absolutely outstanding. And if there's any chance to be prepared, we've done all of the groundwork to be prepared for this crisis. So maybe just to begin with an update on what's happening in the community between our hospital and Martha Jefferson, which is our partner hospital. We have about 25 cases of coronavirus in the hospital at this point of time. If you look at the community numbers, it looks as if we've had somewhere in the range of 50 to 60 people in addition to those in the hospital that have been infected. If you compare those numbers to around the country, they're relatively low, even in comparison to Northern Virginia. Jim alluded to this in his early comments, that when you look at the modeling, and I'll just say that there's 6 different models out there, and every one of them says something different. So nobody really has a crystal ball, but I think over time, based upon the experiences in other places, we're learning more about this disease. It's anticipated for the country that the peak will be the 2nd week of April. I'm certain that our peak here in Charlottesville, Virginia, will be much later than that. The model that we have the most trust in suggests that it'll be about mid-May that it occurs. But again, all of these predictions are tentative, and we continue to monitor this on a daily basis. But what that does mean is that on the good side, we have more time to prepare, and we can model our preparations after the successes or failures of other organizations that have had previous experience with the virus at a much higher level. The hard part of it is that it's going to last a lot longer for us than it will maybe in other parts of the country. Nevertheless, a lot of work over the past few weeks in preparation. And as best as anyone can say, I believe here in Charlottesville at UVA, we are prepared. There are really 3 essential parts of being prepared. One is to make sure you have enough beds. The second is to make sure that you have enough staff and faculty to support the patients that are in those beds. And then something that I know everyone's aware of, just because it's very popular in the press now, is PPE, or personal protection equipment. And what that is the devices and material that we use to protect our providers so that they don't contract coronavirus while they're caring for patients. In terms of beds, we're really fortunate because we had just completed, we're close to completing a new 86-bed tower in our new facility. And although it wasn't ready to be completed till June, we asked our facilities people at the university and our teams in the hospitals to see if they could hasten that date. And I'm really proud to say that 15 of those beds are actually opening today. They're negative pressure beds. They're designed specifically for caring for coronavirus patients. And by May 1st, the rest of those beds will be available. So we actually believe that we're in reasonably good shape, considering the other 615 beds that we have available, that will be able to take care of a fairly large surge of patients if that were to come to pass. In terms of faculty and staff, still in a good place, although we have about 90 individuals now that are furloughed because they've either contracted coronavirus or were exposed to it. And so this is something that we're watching very closely. And then in terms of PPE, this is really challenging. At this very moment, we have enough PPE, but the supply chains are diminishing almost on a daily basis. So we're spending a lot of time here at the medical center trying to create the most thoughtful recommendations about what people should use and in what circumstances, and that's still an ongoing conversation. But lots of planning, a team that's really ready. I'll also mention something that Jim brought up earlier about testing. We were the first in the state to develop our internal test for coronavirus. This is at a point of time, if you went to the outside companies, it would take 8 or 9 days, and we could perform this test in 8 hours. We were actually one of the first in the nation to be able to do this. And we've grown our testing to the point that we're now a resource for the state of Virginia, some hospitals in North Carolina, as well as some hospitals in the DC area. So really showing UVA as a leader in this regard. This wasn't just a health system effort. It really took the collaboration of researchers throughout the university, throwing both their intellect as well as their resources into this effort that accumulated about 2 months ago, where we were the first in for testing. So really proud of UVA. I'm very excited about what we've accomplished there. I'll just finish by saying what a wonderful team at the health system. We have 20 leaders that from 7 to 8 every morning during the week, and from 9 to 10 every morning on the weekends come together, and we spend that hour reviewing what happened in the previous 24 hours and what our plans are for the next 24 hours and trying to predict. And a very collaborative group, a wonderful effort. And I think it's because of this really outstanding team that we've been so successful in being prepared. I'll also compliment the university. This hasn't just been a health system effort. And I'll give you a few examples of things that have happened across the university. I already mentioned testing. There were many, many scientists that weren't part of the health system that contributed materials and ideas to our testing efforts. So it really was a university effort. Also in engineering now, we have people that are making three-dimensional swabs and face masks, trying to enhance the amount of PPE that we have. I mean, talk about creativity, just an incredibly important time. And also there was a university-led effort that was outside of the health system to collect PPE, that could be used by our healthcare workers. And this was something that was initiated in one of the schools outside of the School of Medicine and Nursing. So really, this has been a university-wide effort. I'll just finish by saying I couldn't be more proud to be part of the University of Virginia. We're doing this well. We're a leader, and I think we'll keep you safe during this crisis. So thank you. Liz, I think, or Jen, I think you're next.
Hi, everyone. Thanks, Dr. Kent. Thanks for the opportunity, and a huge thank you to everyone for their dedication and patience in this challenging time. Today, I'd like to cover 3 areas very briefly. First is operational changes that have affected our students, staff, faculty, and contractors. Second is a discussion around financial planning. And last but not least, emergency preparedness, which we're doing planning with both the city and county. So as you know, we've experienced significant operational changes. As Liz and Jim have mentioned, our shift to online instruction, and most of our students have returned to their permanent residences. However, there are services that are available for the few students that cannot go home. Student activity spaces, libraries, public university venues, and all fitness facilities are closed. Transportation services are reduced, but are still available to meet the workforce needs of UVA Health. All events, as you know, through June 30th have been canceled or postponed. Employees are telecommuting, except those who must report in person to carry out key functions for their units, their schools, or UVA Health. As you know, modifications all comply with the governor's recently announced executive order, which requires all Virginia residents to remain at home unless they are traveling to and from work for essential business or for essential services. The good news is that UVA is allowed to continue operations to facilitate remote learning, as Liz talked about, perform critical research, or perform essential functions, most notably UVA Health, as long as social distancing requirements are maintained. In all these decisions, sustaining health and safety has been our primary objective, following immediately executing on the university's core education and healthcare missions. So just like institutions and businesses across the country, we recognize that these decisions that we have had to make have a significant impact on members of our UVA workforce and our community. And we have worked hard to try to meet most pressing needs of our students, faculty, staff, healthcare workers, and contracted workers in this very truncated timeframe. So a couple quick things on students. As you know, Liz talked about, we developed processes for students to apply for emergency funds to enable a large majority of our students to go home. In addition, there's funds for technology so that they can continue their education unabated. For our dedicated workforce, we've expanded benefits for our employees. We've added a new telehealth benefit. We've expanded backup options for dependent care, particularly important for our UVA Health partners. And we're also trying to coordinate various types of new UVA state and federal leave. We are also working on the redeployment of employees for whom your current work doesn't allow you to telecommute or work effectively from home. Next, I'd like to turn to the contractor workforce. Given the change in UVA's operating status and reduced demand for services, for example, our contractors are not providing dining for now over 7,000 students daily through spring. Some contractors have needed to furlough their employees since there's no student dining fees to support the operations. Obviously, this is disappointing to all of us. We want to return to normal operations as soon as it is safe to do so, and we're hopeful that these reductions will be temporary. We are disappointed that the federal relief package did not send funding directly to employers, which would have allowed their workforce to remain on the payroll. However, I think there are some critical updates that are important to mention. We have asked our contractors to structure any reductions in workforce in ways that enable their employees to take full advantage of new federal and state relief. We hope that many of the contracted workers are eligible for a number of federal unemployment benefits. In some cases, this will increase typical unemployment insurance benefits and extend wages during this period of hardship. Also, many will be eligible for new one-time federal tax cuts between $1,200 and $2,400. As you know, this is very fluid, complex, and there's not a one-size-fits-all solution. But we are continuing to talk with our major contractors about what they are doing. Aramark is one specific contractor that has had great interest to many, including us. We want to mention a few things that they have told us they are doing for their employees. They have expanded their employees' benefit coverage by providing additional sick leave, health benefits, access to telehealth, and employee assistance program. Beginning next Monday, they're also implementing drive-through meal pickup program, offering 5 meals per week for Aramark employees and their families that have been furloughed. We are in a challenging and uncharted times right now, but it is still all about the people. We are committed to trying to do everything we can, including working with our contractors to help meet critical needs of the people who make up our UVA workforce and community to sustain the university so that it remains an excellent place to learn and work. Next, I'd like to really quickly turn it to financial planning. As you know, the duration and intensity, as Jim has mentioned, has real implications for the university. We are currently estimating financial impacts for the period of time mid-March through mid-August and trying to find ways to mitigate them. We are modeling options to contain costs both at the academic division and UVA Health, and we, the leadership team, will outline short-term approaches in the coming weeks and months. Lastly, in terms of pandemic emergency planning, the university's critical management team was implemented in early March and continues to meet regularly. We've also implemented the Emergency Operations Center in collaboration and coordination with the city and county, working with them on a daily basis to manage and coordinate efforts all through this pandemic. Obviously, we're focusing on maintaining healthy healthcare workers and first responders, but also supporting patients under investigation with potentially being COVID positive, and ultimately patients who are COVID positive under our direct care. Also seeking to find ways to support more vulnerable populations in collaboration with the city and community. So I'd just like to say in the coming weeks and months, it's critical that we learn more about this virus and the impact of our ability to social distance now to bend this curve. I'm really deeply grateful for everyone in the UVA workforce and community for their dedication, their commitment, and hard work during these unprecedented times. And I'm especially grateful to everyone on the team who's worked so hard to just get us here today. There is still a ton of work to do, but I do believe together we can rise above this challenge and emerge as a stronger organization and community. So thanks, and I'm going to turn it back to Jim.
All right, thanks Liz, JJ, and Craig. So we have a bunch of questions that I will read and then ask, I'll either answer myself or ask Liz, Craig, or JJ to answer. So the first is, are salary reductions or furloughs being considered at this point, or will they be in the future? So picking up a little bit on what JJ just said, and going back to the email we sent in the middle of March, for our own employees, we have committed to honoring employment contracts for the foreseeable future. That has not changed. there are really three categories of employees: some who have to come into work to perform their jobs and are essential, some who can work remotely, and some who can't work remotely. We've made the decision to keep everyone on the payroll for the foreseeable future. This is made more difficult, frankly, by the way the federal government structured its unemployment aid. It would have been a lot easier if we had funding to help us keep employees on the payroll, but we've nonetheless decided to do that. How long we can do that will depend an awful lot on projections for the fall. And like I said, we are working to figure out the date by which we need to make that decision. JJ, I don't know if you have anything else to add.
No, I think that's it.
Okay. Is there a plan to provide UVA's contract employees with financial support? I think JJ covered that a bit, but I don't know if you have any more you want to say.
Yeah, we're continuing to work with the contractors, the extension of the health benefits and the dining, and we continue to explore ways we can support. We're also in conversations with the city and the county around these issues and how best to support contractors.
Is the university, I think this is one for Liz, is the university going to a mandatory pass-fail? I hope you are sticking with the opt-in option. Thank you for everything you're doing.
Thanks for the question. I've gotten this question from many students and parents, and I know the president has as well. We deliberated as thoroughly as we could when we made the decision to go to a default credit, no credit for all classes, with the option for students to choose at the end of the semester that they want to take a grade. We do not have present plans to change that policy. We're actually getting closer to the end of the semester, and a change is has its own costs. Everyone's adjusted to this or has built their expectations around it. One thing I will say is that the reason we selected the last day of classes for the date for students to choose whether they want to take a grade is so that students would be in a position to both understand what has occurred for them in the course of this semester. That is to say, there might be something that happens in the third week of April that has a very large effect on the students' view of what they, whether they want to take a grade or not, but also give students the capacity to be able to say that they chose a grade without knowing what the grade was going to be, which is to say before the, in a classic class, before the final exam. I know this has caused some difficulties, but that was the goal. And no, we don't have present plans to revisit it. Of course, the world can change very quickly, and if barring some very dramatic change in the state of the world, our policy is staying as it is.
Thanks, Liz. I think this is for you, JJ. Do you have any information for temporary workers whose assignments are expected to end soon?
Yeah, we're continuing to explore that. At the moment, nothing past the foreseeable future. So we'll have to address that if the duration of this happens through summer or fall.
Okay.
Status quo as of now.
Okay. Craig, this is for you, I believe. It's a two-part question. Now that the FDA has approved a serotherapy protocol, will there be a push to find convalescent patients and begin therapy at UVA? That's part one. Part two, I guess this is both for you and for Liz. How will UVA help permit and support coronavirus research proposed by existing virologists here at the School of Medicine?
So maybe I can begin. We have some very talented researchers here in the health system at the university that are doing some really wonderful work in the virology field, but also around coronavirus. And so we've encouraged them to double down on their efforts. That's more complex in our environment, where we're trying to create an environment where we can have social distancing, but working with those investigators in a way that we can support them to move their research forward, and it's so vital. Another answer to that question is that we have investigators that are not in the virology field who believe that they have tools and techniques that they might be able to modify to have an effect on coronavirus. And so we've encouraged those investigators likewise to venture into that area. We currently have 3 clinical trials that are underway. I don't believe one is the one that you just mentioned, but these are for in-hospital patients, not ones that are convalescent. But nevertheless, research in this area and providing the latest therapy is something that's really important to us. And we have a number of investigators that are carrying that forward. Liz, anything to add?
No, agree with everything Dr. Kent said.
Okay. This might also be something for you, Craig. Are the UVA COVID-19 numbers shared with the Virginia Department of Health and Johns Hopkins? How are the testing facilities reporting positive results? Any insights?
Yeah, so whenever we have a positive test, whether it be in the outpatient arena or in the hospital, our first call is to the Virginia Department of Health, and they're the collection point for all of the positive tests in the state of Virginia. And they actually have a website where they report those numbers out. I would warn people that those numbers that they do report out are usually 2 to 3 days behind our current numbers. We don't report to Johns Hopkins. We're really focused here in Virginia. And then lastly, testing is something that has become really important to us. We have enough testing, I think, to help us be very thoughtful about how we treat our patients here at UVA and also in Charlottesville. But to give some numbers, we're now providing testing services for almost 30 hospitals around the state and in surrounding states. So something I guess I mentioned earlier, UVA is really in the lead.
So this one, you mentioned difficult financial decisions to come. Can you speak more to that? So this really relates to the fall and whether we're able to be up and operational in the fall. If we are not, we're going to face some pretty difficult financial decisions because that would mean a major disruption. I mean, this has been a serious disruption to our normal operations, but if it has to continue into the fall, that brings it to an entirely different level. I don't know if anyone else has anything to add. Okay. You may have already answered this, Craig, but is UVA hospital testing COVID-19 antibody treatment?
So the answer is I don't know. We have so many investigators that are in the laboratories doing different work, and I saw that question, and I don't think I know the answer. It well could be the case. But the good thing about text and the ability to have Zoom is that Dean David Wilkes just texted me and told me that we have in the IRB a convalescent serum clinical trial, and it's on its way to us. So good that I can get online updates from my dean, and excited that we have that trial.
All right. Is there any way to send food delivery, gift cards, or other thanks and support to hospital staff?
So the answer to that is absolutely. And if we want to coordinate that, it probably should be through my office. So if there's a sense that that might be a possibility, please contact my office and we'll make that happen. I will shout out to the somewhere above 13,000 individuals that work as part of the health system, and every one of them is working day and night really, really hard to take care of our patients. And any opportunity any of you have to say thank you through a gift card or just a shout out, that's something that I think would really be appreciated. They're doing great work. I couldn't be prouder to be part of that team. And if that's an option to say thanks to our people, please let us know and we'll help facilitate that.
Great. Next question, are there plans to reimburse students for housing and/or tuition? And then I can combine that with the next question about whether tuition for online classes will be reduced in the fall. So we have not, we are reimbursing students for the portion of their on-grounds housing costs. We are not reimbursing for tuition. That funding is necessary to pay the salaries of faculty and staff who are continuing to produce the online courses. And in fact, the shift to online courses has increased our costs rather than decreased them. I recognize that being online is not the same as being on grounds by any stretch, which is why one of the questions we're going to have to talk about is what happens if the fall is online, and what do we do with the costs that we're facing and what we're asking students and families to contribute. And I don't know whether Liz or JJ have anything to add to that. Okay. I think we answered the question about going to pass fail. Oh, Craig, this is for you. Is our testing technology being shared with other institutions?
The answer is absolutely yes. Not only are we doing testing for other institutions, but we're trying to help other larger institutions that have the capability of doing internal testing. We're trying to show them how to do it and what are some of the secrets that we had and what allowed us to be so successful so early. A good example of that is Nova in Northern Virginia. Should have testing coming online very soon, and a large part of that's related to the fact that our people in our laboratory have been speaking to the laboratory people in Nova, and I think really enhancing their efforts. So we're trying to do everything we can out of UVA to help everybody in the state be successful.
Can anyone speak to community resource recommendations for PPE in the community setting? In other words, what should the average citizen wear when out for essential activities?
So that's a difficult question. First of all, I feel like the most important advice that we can give our community members is social distancing. And it's interesting because sometimes when you wear a mask or gloves, you have this false sense of security that you're protected and that you don't need to have social distancing. So much better to pay attention to being in your house and away than it is to worry about what you should wear when you go out. The other part of this is that there's not enough PPE for the providers in the hospitals to take care of the patients. And we're struggling, as is every medical center across the country. So if we can preserve what's available for where it's really needed, which is in the hospital, I think that really has to be our primary effort. So I think in the community, social distancing, that's really the major approach that one needs to have.
What provisions are being considered for students' belongings remaining in UVA housing? So I'll start and JJ may be able to say more. This is something that we're turning our attention to now. Our hope was that there would be an opportunity for students to come back and collect all of their belongings, but with the new stay in place order extending to June 10th, we have to start looking at alternatives. I don't know if you have anything to add, JJ.
No, just we're doing contingency planning at the moment. It's post June 10th, unless there's an emergency situation, and then we'll manage those one-off. Again, if there's an emergency, need to get medications, for example, out of the dorm room, then we'll make provisions for that.
Right. Okay. Can you give us a sense of what kind of decisions are being considered for junior faculty members' tenure clocks, especially those whose research involves field work, and is that a standstill?
Whoever submitted this question, I encourage you to contact me directly. The deans, the associate deans, and the faculty senate have all been discussing this, and we have a recommendation that is all but completed. So whoever, my email is MEM2A. Feel free to write me directly.
Okay. Has the university been in communication with landlords and rental companies? How will the university support students who are not able to make rent? So I can answer this. So we have been in touch with them. We have made the decision not to reimburse students who are living off grounds wholesale, but we do have funding in place for students who are facing significant financial hardship. And that includes paying rent. And I would say for anyone who is in that category, to reach out to the Dean of Students, and we'll put you in touch with someone who can help. Next question, is there anything we can do to help our healthcare workers?
Well, I'll hearken back to the suggestion made earlier, sending gift cards, saying thank you. Again, just an incredible workforce that's doing their best to really stay ahead of this crisis and help people and help the community. I also think there is an issue that some of our healthcare workers have in terms of childcare and the ability to partner around childcare for when children are home from school and they're young. I think there could be an opportunity there. And then, you know, the drive that we're having around PPE. I mean, if there's the ability to help consolidate PPE so that our healthcare workers can be protected, that's great also. But I think most importantly, just say thank you. If you can do that, I know it'll be so much appreciated.
With unemployment on the rise, will UVA be able to sustain its current financial aid program? I can say that we are committed, strongly committed, to continuing to meet 100% of demonstrated financial need. We're only one of 2 public universities that does so. It's a big part of who we are and part of our mission. And especially now, given the difficult economic circumstances that a lot of families are facing, if anything, will strengthen our commitment to continuing financial aid. Can you comment on how UVA is working with the Charlottesville community to protect public health and eventually help facilitate a holistic recovery? JG, I think you can best speak to this.
Yeah, we are in constant communication. As I mentioned, we have the EOC, which is a cross-section of city, community, county, as well as UVA officials working. Primary focus has been threefold. One is our emergency responders and making sure they all city, county, UVA officials have what they need in order to provide the emergency services. Second is to look holistically around the needs of the broader community. So recently, for example, when we closed our dining facilities, all of the food we donated back to the local community. So lots of work there. And then third, there's still more work to do. So we've been talking about how do we best meet people with needs in this world of being required to socially distance. So working with the mayor, working with county execs to think about what else can we do, whether it's redeploying some of our workforce to help, and also thinking about the most vulnerable population. So how do we support perhaps a COVID positive person who lives in a nursing home who can't return post leaving UVA Health? So all of those efforts are underway. It's highly collaborative. We probably will need some more help along the way. So again, as we think about people who have excess capacity or time on their hands, please stand ready to volunteer as we think through how best together we can work through this crisis and then begin recovery.
So I might add to that and compliment our faculty and staff. We developed a COVID clinic for patients to be evaluated for the virus very early on. And it was interesting because we asked for volunteers to staff that clinic and faculty and staff, and we had about 3 times as many volunteers as we needed. So it was just wonderful to see people stepping up to help our community and treat this problem. And so that clinic has grown busy, so we opened another, and that clinic has grown busy, so we opened another. So now we have 3 clinics throughout Charlottesville to see all patients that might be in need and wishing to have some level of evaluation. So very, very, feeling very good about the health system stepping up at the right time for the community.
This is a question for Liz. Have you considered canceling final exams for students or making final exams optional, given all that students are dealing with?
Good question. Canceling final exams altogether, I would say, has not come up as a conversation between and among the deans and the academic deans in each of the 12 schools. As far as I know, maybe I'll get a text like Dr. Kent did about something I'm not aware of from someone I work with. Adjustment of the requirements of classes. I mean, part of it is not every class has a final exam. Many classes have assessments throughout the term. So adjustment of the requirements to meet both the virtual environment while still allowing students to learn the material that they took the class to learn. I would say those are the things that the deans and faculty, in fact, the chairs of departments have been talking about. But thanks for the comment, and I'll bring it to the folks. There is no present plan to cancel final exams, though, I would say.
Will there be a virtual Days on the Lawn for admitted students?
Yes, there will be. There will be more than one.
So I can add to that by saying I live in a pavilion on the lawn and I'm really lonely. So I think if anybody that wants to show up virtually would be extremely welcome.
Emphasize virtually.
Yeah,
I did.
Okay.
yes.
All right. So in light of the fact that we're unlikely to see the peak until late April and into May, why hasn't the medical center reduced ambulatory services past April 24th to prepare?
Well, one part of this crisis, and we've all learned that things change from day to day, they change from week to week. And I gave somewhat of an impression earlier that we have models and we might be able to predict the evolution of this virus, but the truth is that we can't. And so we need to monitor the numbers of patients with the disease on a daily basis, the trends, and have a really good sense about how we're going to deal with this as the weeks and months to come. And so what we're trying to do in terms of decisions around elective surgery and around our clinics is have at least a 2 to 3 week window where we'll think about what the environment might be and then decide whether we continue to cancel elective surgery, whether we continue to cancel our ambulatory clinics. And that period of time is 2 to 3 weeks. Now, if you were to ask me, I suspect that beyond the date in April that we've chosen, we probably won't be able to open our clinics. But again, it's a fluid crisis, and I think we're monitoring it on a daily basis, and we're trying to make these decisions so that people have 2 to 3 weeks notice, and that's the strategy that we've taken.
What can the incoming class of 2024 expect for on-grounds registration orientation this summer?
Great question. I earlier talked about our summer session plan, which is a range of academic and other program activities that happen on grounds in the summer, and that we are not doing anything in person. This is the recommendation the leadership the decision the leadership went with before June 30th. So nothing on grounds before June 30th. One reason for that June 30th date was many of our orientation and registration activities happen starting in July. We will make an announcement about July and August no later than June 1, as the announcement from indicated. That was, we have a desire to preserve the possibility of doing something on grounds, but it's possible we won't be able to do something on grounds in July, registration and orientation, and we are making plans to do this virtually, simultaneous with the hope that we have news from the virus, if you will, that allows us to do something on grounds. But we have big plans for a creative and informative and useful registration orientation, even if it's virtual. And if I may say, congratulations to an admitted students from the class of 2024. Bravo. I hope you and your parents are incredibly proud. Very tough to get in.
So when will there be news on graduation rescheduling? There should be news pretty soon. So the group I mentioned is now looking at potential dates to hold final exercises here on grounds sometime in the fall, and figuring out the right weekend for that. And they're also thinking about ways that we could commemorate graduation on the day that it was supposed to happen, virtually, obviously. But I know that they're really keen to reach out to graduating students to get their views. So it'll take a little bit of time to get that feedback, but everyone, including myself, is very interested in settling this as soon as possible. So stay tuned. Okay, we have time for a few more questions. Is there a direct telephone line for individuals in the community with symptoms and concern for COVID infection besides referral from PCP?
The answer is absolutely. And of course, if I was prepared, I'd be able to tell you what that number is, and I'm not. But we can make that available. There is a telephone line that you can call and be screened, and then some triage as to whether you need to go to a clinic or not.
So if this is not already part of the frequently asked questions on the coronavirus website that we have that I mentioned earlier, we can certainly put it on there. And I will say, looking at this long list of questions, we're not going to get to all of them, but we will group ones that were asked repeatedly that we didn't get to and update the FAQ section of the website. Okay, JJ, I think you talked about this a little bit, but here's a follow-up question. Will workers who may have less demand on their time working remotely be redeployed to help in higher need areas outside their normal job functions?
Yes, that is our goal. So we've been asking people who work for UVA who are in effect underemployed. Once we have a list of jobs where we need demand, we will be reaching back out through their managers and supervisors. So yes, obviously with all the appropriate social distancing and/or to be able to do it in a telecommuting format. But yes, we are experiencing areas of need, and we'd like to match our workforce to that.
So Jim, if I could interrupt, the number is 98 COVID, COVID, or 434-982-6843. Again, the wonders of text, but that's the number.
Okay. Is UVA undergraduate admissions considering extending the decision deadline to June 1st, as many other colleges have done? I assume that's the date by which you need to submit a deposit.
Deposit. At the moment, we're considering all options. At the moment, we're still at May 1, but I take that to be feedback that someone would like it to be extended. We're hearing lots of feedback on this question, so thank you.
All right, we have time for one last question. And there was a question about how we are dealing with students who are serving in the National Guard.
There's been a lot of publicity about a particular situation in the law school. This is a student. First of all, I guess I would start by saying we have a large number of students and faculty in the reserves and open to be called up. And we have historically and to this moment had an incredibly close relationship with our students who have served. And I could say more about that, and feel that it is an honor to have these students who are being called up to serve the country and have done service in the past. So I'd start with that. There's some information out there that UVA Law School has told a student they cannot continue in their classes after having been called up. I know firsthand that that is not correct. There is a process whereby the student is filing a petition to get an exemption from the standard rule that exists at every graduate school, probably, and every school, that if you have a full-time job, you cannot also be a full-time student. That is a pretty standard rule. So as I understand it, the timing and the facts at the moment right now on the ground, which is sort of inconsistent with what's been reported in a lot of outlets, is that the student involved is seeking to continue the work while continuing to be a student this term with online classes from the law school. So, and I think we take that approach with any other situation that confronts us.
All right, thanks, Liz, and thanks to Craig and JJ, and thanks to all of you for the great questions. Like I said, we will post answers to the frequently asked questions on this call on the website. We'd love your feedback about whether this was useful, and if so, we'll schedule another one. In the meantime, thanks again to all of you for everything you're doing. I've said this before, I've been part of this community for 30 years, and I've never been more grateful to be a part of it than I am today. What we're facing is really difficult, and it's going to require all of us working together to confront it. So thanks, be safe and be well.